SPECT is the study we do at Amen Clinics. It looks at blood flow and activity, looks at how your brain works. The image on the left is a healthy brain, full, even, symmetrical activity. Color doesn't mean anything, it's the shape. The image on the right, you can see all the holes, especially in the back half of the brain. Traumatic brain injury. Drug addict brains just looked awful. So this is what we see with OCD, obsessive compulsive disorder. See, the front part of the brain works so hard, you can't stop thinking. Or this is somebody who has post-traumatic stress disorder. Their emotional brain works way too hard. So this is a scan of one of my patients with sleep apnea. Looks like they have early Alzheimer's disease. Untreated ADD, or ADHD, is one of my specialties. There's a lot of misinformation about it. It's real, and when left untreated, it ruins people's lives. The hallmark symptoms: short attention span, easily distracted, disorganized, procrastinate, and impulsive. And there's a higher incidence of people who have it, who get divorced, who file for bankruptcy, who go to jail, who lose their jobs. And if you have these symptoms, and not every once in a while, because all of us have them every once in a while, but they've been sort of the story of your life, and your teacher said, he's really smart, but only if he tried harder, or she should not talk so much, that it's really worth getting it assessed and treated. Okay, so care, and then you want to know what are the things that hurt your brain and stop them and do the right things. So I'm going to fill that out for you. Care, stop, do. I mean, how simple is that? So what if mental health was really brain health? And that's my experience. If you get your brain right, you feel right, you act better, life is better. Okay, so I said all of that to get to this slide. This is the most exciting lesson I've learned from looking at 115,000 scans on people from all over the world. You are not stuck with the brain you have. You can make it better, and I can prove it. And I love that. 4 simple things. Baseline brain health assessments. If you don't know, if you don't look, you don't know. I mean, it's as simple as that. So if you have suffered from an addiction, from ADD, from anxiety, from depression, OCD, bipolar disorder, welcome to normal. But I never want your labs to be normal. I want them to be optimal. But that means you have to get them. And I think on a yearly basis. Okay. This next piece is really important. And in Miriam's EHT product, it's not just EHT. And there's a reason for that. And your brain gets sick in multiple ways, so it will get better in multiple ways. So assessment, optimize your numbers, better in multiple ways. So for example, we use omega-3 fatty acids to decrease inflammation and improve your mood. I love ginkgo and vinpocetine because they increase blood flow and memory. Probiotics support gut health. We talked about that a little bit. B vitamins and phosphatidylserine for nutrient loading. Huperzine A, which is in Miriam's product, boosts acetylcholine. And EHT for tau protein and brain cell structure support. So as I've learned about EHT, I started taking it because I know with my NFL players, some of you may have heard of this thing called CTE, or chronic traumatic encephalopathy, that their dementia is not at all like Alzheimer's disease. It's actually a tauopathy, or a problem with tau. So tau is the cellular structure. So it's the protein building block to keep your brain cells strong and the mechanisms inside the cell working. So EHT helps to support that. Well, they've actually isolated EHT which optimizes, Dr. Stock is going to talk about PP2A and how exciting that is, but it keeps your connection strong, supports memory, focus, energy, and your immune system. So it's very exciting, and the Nerium product actually has a number of other nutrients to work in this multiple mechanism approach that I talked about.